Hi, Dr. Eric Lund here, specializing in short-term care for your neck and back pain, and welcome to your weekly pain relief video. This week I'd like to talk about some topics pertaining to lower back pain. Oftentimes we're told what to do for lower back pain, but what should we not do for lower back pain? And so I want to talk about a couple areas. First one is ice versus heat. The second one is ignoring lower back pain, and the third one pertains to, should I rest this or should I stay active? So let's start with the ice versus heat, because this is a very common question that I'm asked. And so typically what I will say is I think it's always best to start with ice. And one of the reasons why is because ice has a very rare chance of making your lower back pain worse. In addition, when you experience lower back pain or an area is injured, there's a good chance that there's inflammation and swelling within that region of the body. And so when we apply ice to that area, what it's going to do is it's going to draw fluid out and swelling out. So it's going to have an anti-inflammatory effect, and that's what we want to have. Commonly what I'll hear patients say though is that, well, when I put heat on it, it feels really good. And that's true. Oftentimes people will put heat on and it feels good, but it actually can make them worse later. And the reason why is heat is a vasodilator. So basically it's going to bring fluid into an injured area. And so if something is swollen or inflamed, that's not what we want to do. So again, I always say start with ice. Now if it's chronic lower back pain, something that is ongoing, has lasted longer than 3 months, then sometimes it's okay to start with heat. But commonly I'll recommend that patients switch between ice and heat. So you ice it, then heat it, and then I always recommend ending with ice, again for that anti-inflammatory effect or pulling the fluid out of the injured area. The second area is just commonly people think, I'm just going to ignore my lower back pain. And sometimes that lower back pain will get better on its own. However, I always think it's key to do treatment sooner rather than later, because then you can prevent it from becoming a disabling type of lower back pain. And so if you want to reduce the chances of it interfering with your work or interfering with golf or something that you enjoy doing, then I think it's better to receive treatment earlier rather than later. And so essentially this would be, warning signs like where you twinge your lower back or your lower back doesn't feel 100% but it's not disabling yet. That would be the time to come in and receive treatment. And then the third area pertains to rest. Should I rest this? Now some people think that when they have lower back pain or when it's injured, they think maybe I should just rest and that's the best thing for it. And that's actually not the case. We actually want to have movement, and movement will actually help the injury heal faster and reduce the time that you're in pain. And so generally what I recommend is that patients go about and do their normal activities. If there's a little soreness, that's okay to work through. But if they do anything where they experience sharp and shooting pain, or they just can't do it, then that's a activity that they want to stop doing, or they want to modify that activity. But actually remaining active in a smart way will improve the healing time or the time in which you're in pain. So I hope you have found those tips helpful. If you're still looking for additional information as it pertains to lower back pain relief, I'd encourage you to go to my blog, www.drericlundblog.com, and there you can download a free guide for back and neck pain relief. So again, thanks for watching, and we'll see you next time.